On our Bronson Health Chat for this week, on average, one person in the U.S. dies from a stroke every 4 minutes, but up to 80% of strokes can be prevented. May is National Stroke Awareness Month, and while most occur in people over 65, they can happen at any age, and the faster you get to the hospital when you have stroke symptoms, the better. It's critical to act F.A.S.T, F-A.S.T. Dr. Larry Morgan is a stroke specialist with the Bronson Neuroscience Center and neurocritical care unit at Bronson Methodist Hospital here in Kalamazoo, and is with us this morning on WKZO. Dr. Morgan, good morning.
Good morning, Ken. How are you?
I'm doing very well. Thank you so much for joining us this morning. Definitions, I guess, to start. What exactly is a stroke?
So there are two big classifications of stroke. The more common type of stroke is one in which a blood vessel becomes blocked and blood flow is prevented to a certain portion of the brain. And this is what we classify as an ischemic stroke. The other big classification for stroke is one in which a blood vessel will break open and bleeding occurs in the brain. And this one we classify as a hemorrhagic stroke.
Signs and symptoms of a stroke, what are they?
Yeah, so there can be many signs and symptoms of a stroke, though the most common are covered by that acronym you mentioned, F.A.S.T. And so that stands for facial drooping, arm weakness, speech changes, and time is what T stands for, because time is very, very important when treating stroke symptoms. The faster we can treat people with strokes, the more likely to have a good outcome.
Dr. Morgan, there have been some recent stories in the news about a possible link between COVID-19 and strokes. Have you seen this at Bronson? Is there anything to this?
Yeah, that's a great question. So there certainly have been some reports of strokes occurring with COVID-19, particularly in young individuals. We have seen several cases of individuals that are young and don't have the typical risk factors that we associate with strokes and have tested positive for COVID-19 and also suffered a stroke. The reasons behind this aren't entirely clear, but we think it's related to the body's response to the virus that causes COVID-19 and resulting in an increased likelihood of developing blood clots in multiple areas of the body, including in the brain.
Dr. Larry Morgan is with us on our Bronson Health Chat this morning on WKZO, talking about strokes during Stroke Awareness Month. Can strokes be prevented?
Yeah, absolutely. So many strokes can be prevented by working with your primary care doctor to carefully address many of the risk factors that can cause strokes and help manage their chronic diseases. There's no single medication or treatment that can prevent all the strokes, and controlling these risk factors can be pretty complex. It requires evaluation of each individual's unique factors and create a strategy that will work for you. As for the strokes related to COVID-19, it's always best to be mindful of social distancing practices, washing your hands, avoid touching your face, covering your coughs and sneezes with your elbow, and being respectful of the stay-at-home orders issued by our public health officials.
If someone is having symptoms of a stroke, is it safe to come to the hospital right now?
It is absolutely safe to come to the hospital if you need care. We know that many people are being pretty cautious right now, and as they should be, but our number one priority at Bronson is the safety of our patients, our employees, and our community, and we've taken all the necessary precautions to make sure that you can safely get the care that you need. We've taken steps to separate those that are needing care for COVID-19 from other patients. If you have symptoms of a stroke, we want you to call 911 to get to the closest emergency department as soon as possible, because time is of the essence.
Why is it important to call 911 as opposed to, say, driving or being driven to the hospital?
Yeah, so many people think it's faster if they just drive themselves to the hospital, but the reality is that we see the professionals that work on the ambulances as an extension of the hospital emergency department, and there are often problems that they can diagnose early on before you ever reach the hospital and start treating right away. The other advantage is that they can give us a heads up before people arrive that they're bringing someone in that's possibly suffering from a stroke, and that gives our stroke response team a chance to assemble and be ready to evaluate the person immediately on their arrival. And as we've talked about before, time is extremely important, and so that can ensure the best outcomes for everyone.
Dr. Morgan, where can someone go to learn more about stroke care at Bronson?
Yeah, so the best place to go is bronsonhealth.com/stroke.
Dr. Larry Morgan has been with us on our Bronson Health Chat for this week. Dr. Morgan is a stroke specialist with the Bronson Neuroscience Center and neurocritical care unit at Bronson Methodist Hospital here in Kalamazoo during this month of May, National Stroke Awareness Month. Very important information. Thank you so much for joining us and sharing with us this morning.
Thank you for having me.
on News Radio 590 and 106.9 FM WKZO.